of having this surgery, you can like look back on my videos and learn from my experience how I was or what to expect. What's up guys, back with another video, and it's been a long time since I uploaded. It's been about actually just a little over 2 months, and there's a few reasons for that. One of the main reasons being that gyms have closed. I'm here in France, and we've been in full lockdown for about a month now, or a little less than a month. But even before we went back into full lockdown, we actually closed the gyms I believe 3 weeks prior into going into full lockdown, because they were trying to contain the progression of the virus while also trying to keep as many things open as possible. But unfortunately the virus numbers kept going up, and then so we had to close. And then so the other reason being was my injuries. I have a few injuries that I have not spoken about yet, and so my injuries just got really bad. So I'll just list the injuries that I have. I have a torn labrum in my right hip. I had a torn labrum in my left hip, which was the worst one of all my injuries. And I also have a bad knee, which is the second worst. So the bad knee happened when I was playing basketball. I was in a fast break. We were playing outside, and I was wearing indoor basketball shoes to play outside. So do not wear indoor basketball shoes to play outdoor basketball. So I was in the fast break, and I was gonna go for a dunk, and when I put my foot down, it just slid. And then so what happened was, as my momentum was coming, my body kept going and my leg stopped. And then so I hyperextended my knee, meaning it went inwards like this. And then that was also about 3 years ago. So now this video is gonna be mainly about my hip, my left hip. As I said earlier, I had a torn labrum in my left hip, and I got that repaired on the 12th of November. Got that repaired on the 12th of November, and then so I'll explain to you guys the surgery and the symptoms before I got the surgery. So before the surgery, like I said, my left hip was really bad, and so in all the videos you've seen me do since I started my YouTube account, I've had a torn labrum. And over the last 3 years or 3.5 years, I really had to limit what I could do. Like, for example, I couldn't squat without pain. I couldn't do lunges without pain. So basically anything that really involved me having to go down like this made it very difficult to perform the movement. But over the last few months, it got really, really bad. And then the video, so I have a video, I'm actually gonna upload that for you guys, where that was back in June when I was doing some jumping on bleachers, and that's when the hip really took a turn for the worse. In the video, as you can see, I didn't stop going, but in one of those jumps I actually felt something really pull, and it was really painful, but I just kept on going. Which was not a good thing, by the way. But ever since then, back in June, the hip just progressively got worse and worse and worse. And even like the 2 months before the gym closed, like I really couldn't do anything. Like I couldn't squat without any weight because I had so much pain. I'll show you guys where the pain was. So as you see in this area right here, that's really where whenever I would squat or go down, I would feel an intense pain right here and weakness as well. So I couldn't really do anything anymore. So that's another reason why I haven't uploaded, because the pain just got so bad I couldn't do the movements that I want to show you guys. And also my knee was just killing me. Like anything, jump roping, just anything was just killing me. And then so finally I decided it was time to really do something about the hip. And then so that's where I went to the doctor, and we started setting things up, and we scheduled a surgery for November 12th. And then so now I'll get into the actual surgery. So during the surgery, what happened is the doctor put three small incisions into this area, about 1, 2, 3. And then so he will put the instruments such as the camera and the other instruments, the cutting tools as well, I guess. He put the instruments in there. So at first what they did was they removed the femoral head, which is the bone that connects your leg to the socket, to the hip. And then so they dislocated it, removed it, like moved it out of place, so they can have some working space in there. And then from there on, he removed some bone growth, I guess. He shaved it down, made it more smooth, and then he put some anchors in there as well. So basically the anchors are, you take a screwdriver and then you drill it into the bone, and then that's where that gives you like a base for where to put the sutures. Because so what they do is they take like a little rope or whatever it's called, and they attach, well, not attach, but they put together your labrum back onto the actual bone. And then so there's a lot of videos on the internet. If you look up arthroscopic hip surgery, you'll find somewhere they actually display the actual surgery itself. And then so he did that, put the labrum back together, because he said my labrum was like really, really bad actually. He said the surgery was definitely needed because the labrum was basically detached from the actual bone or whatever. I'm not a doctor. But so he did that, and he removed some inflamed tissue. Even though, thank God, the cartilage is looking good though. He said the cartilage is good, so there's no problem with that. And the reason I got to surgery was so that I can get back to doing the things that I love, and also provide you guys the videos and the workouts that I love doing, and the stuff you guys also learn from. And also because my quality of life, unfortunately, the pain got so bad where going up and down the stairs was a struggle. I'd be laying in bed and it'll be hurting, getting off the couch will be hurting. And then so I was like, man, like I can't do anything anymore, unfortunately. So that's why I got to surgery. So now it's been 2 weeks since I got to surgery, and I want to make these videos in a sense where I keep you guys updated with what's going on with me and the surgery. So if you're somebody who's thinking of having the surgery, you can like look back on my videos and learn from my experience how I was and what to expect. Okay. And then so now it's been 2 weeks. So at first, I really couldn't move at all. The pain was ridiculous. But slowly and surely, I've been progressing each day. The pain has gotten better. I didn't start physical therapy until a whole week later. And honestly, okay, so that's something I really want to get in, talk about with you guys, which is the physical therapy. So with the physical therapy, I just want to say, when you're doing physical therapy, you have to listen to your body. Listen to your therapist, but also listen to your body. Because in my case, I am a coach. I do coach athletes, and I have been an athlete. And I like to always communicate with my athletes to make sure that what we're doing is working for them. And if they're not moving too fast or moving too slow, that's very important to me. So I like to make sure of that. And I believe that's the same thing with a therapist. Unfortunately for me, I do believe the therapist has been moving way too fast, way too fast. Because even when I was at the hospital before I left, literally the doctor told me a lot of therapists don't know about arthroscopic hip surgery. They don't really know how to do the rehab, and then so you should go really slow, more so work on the scar tissue at first. And right when I started the physical therapy, my therapist, she just started having me do a lot of movements, and I feel like I'm not ready for those movements. So next time when I go in there on Tuesday, I'm gonna have to have a talk with her, let her know like, hey, we're moving way too fast. I feel like I'm getting worse results than I should be, because after each session with my therapist, the pain in my quad has just gotten really bad. So I'll show you guys. So as you see, this is where the surgery happened, but I'm feeling a tremendous amount of pain down my whole quad, and especially right here where the tendon connects to the knee. The pain is just intense, and each time I've been to the therapist, it's just made it worse and worse. So I need to have a talk with her. Like I said, you know, you have to make sure when you're dealing with therapists, you're dealing with somebody who's working on your body. You have to make sure to listen to your body and explain these things to them. Of course, you know, I can see that there can be some fear where it's like, oh, like this is their job, they know what they're doing, like who am I to tell them how to do their job? But at some point, you know, you have to let them know what's going on, because only you can feel what your body is feeling. And I've definitely spent too much money, and I don't know if you guys know this or not, but surgery is not fun, and I do not want to have surgery again, especially on the same hip, because of bad therapy, because of bad rehabilitation. So gotta have a talk with her, let her know, like, look, man, you know, we can't keep moving like this. I can't do it. It's too much. You know, it's too much pain. But besides that, you know, I do see progress. I'm walking now. Actually, I've been walking with 5 crutches. After a week, I was able to get around with 5 crutches. But it's not like a thing where I can do it all day long or go long distances. Like first, moving around in my apartment, I can, you know, get around without the crutches. However, even in my apartment, if I was to do it all day long, I'll definitely feel it in my leg. So I try to make sure I do use my crutches from time to time. But I am walking, and I've been walking with 5 crutches since 1 week. But I do, like I said, I do use the crutches, and I'm not advising anyone, if you're gonna have the surgery, or if you already had the surgery, or you're, you know, in the midst of it, to stop using your crutches too soon. But, you know, I'll show you guys, because I am proud of myself. As you can see here, you know, I'm walking, you know, so I'm very happy about that, actually. Very happy. So now what's the plan? So the plan is I'm gonna try to keep you guys updated on what's going on with me. You know, with that being said, hopefully the therapy goes well and I can get back to doing what I love to do. But unfortunately, my knee is also pretty bad, so I want to see if I can get that taken care of. I'm already having an appointment with the doctor on March 9th or 11th about my knee. I'm really hoping I don't have to have surgery on it. I really hope so. Maybe they can do some stem cell or whatever, but the knee is pretty bad, so I'm gonna try to figure that out. Really gonna try to figure that out. And with my right hip, which also has a torn labrum, but it's not nearly as bad as my left one. And I probably will have to get surgery for that one as well. But if I do have surgery on that, it's gonna be after this upcoming summer. Hopefully by then my other hip is good and my knee is taken care of. But you know, the right hip is not really that bad. But I mean, it's gonna keep getting worse, as it has, just like the left hip. It's gonna keep getting worse, so I gotta take care of it as well. And I'm doing all this while I'm in France, because USA, you guys have extremely high cost for insurance, and over here, insurance is it's not even, you have like a state insurance here, so the state pays for a lot of things, up to 70%, I believe. And I also got a private insurance, which also takes care of even more of the cost. And I'm only paying like $50 for that. $50 for that, and honestly, it covers way more than a lot of the best insurance do in the US, and that's sad to me. Honestly, that's sad. Like, we gotta have better healthcare system in the US. But I'm gonna try to keep you guys updated. I'm gonna try to make a video about once every week about the hip. And then I'm hoping to also put some other videos out there about, you know, just to educate you guys. So, you know, we'll see, man. But if you enjoyed the video, make sure you like, make sure you subscribe. Take it easy, stay safe, wear your masks, and take it easy, guys. Peace.